I'm Dr. Jim Marsh. I'm chair of the Department of Internal Medicine at the University of Arkansas for Medical Sciences in Little Rock, Arkansas in the United States. I just finished presenting at the 21st World Congress on Heart Disease in Boston, Massachusetts. My topic was on the genetics of cardiomyopathies and choosing wisely. The talk was really about using current diagnostic and genetic tests wisely to select patients for whom genetic testing would be of high yield and potential high diagnostic and therapeutic benefit. Over the years, our universe of patients with cardiomyopathies that we had called idiopathic has shifted now so that some we now identify as familial, going in families, and in current year, we are able to identify perhaps 25 or 30% of familial cardiomyopathies as being caused by a single gene defect. It appears now that the most efficient and appropriate way to test for these gene defects is to not do whole exome sequencing, but rather to identify patients that are suitable for exploration with a panel of about 45 different genes. This appears to be cost-effective and helpful for the patient and for their families. There are some phenotypic markers that are of particular help in identifying the patients for whom genetic testing may be most valuable. That includes patients with a family history of heart failure at an early age or of sudden cardiac death in the family, certainly. Also, patients with an elevated creatine kinase or CK level are high yield, those with a muscular dystrophy, and a large group, those with a conduction abnormality on their electrocardiogram. For those patients, genetic testing can be helpful in ruling in or ruling out a specific gene defect and identifying high-risk genes that may modify therapy. For instance, in those who are associated with high risk of ventricular tachycardia, one can then recommend early implantation of an ICD in conjunction with assessment of their ejection fraction. So we are making progress in this field, and we expect that we'll have a number of additional single gene defects identified in the next few years.